Good morning, this is Johanna Pasqua, and in this video I wanted to present my nursing philosophy and how that ties into my connected nursing theory, ethical revisions, and ambitions for the future. First, I wanted to go into why I chose nursing as a profession in the first place. I initially chose this because my family were the main motivators. My mother is an RN, my dad is a CNA, and my brother is graduating with his BSN this semester, which I'm very proud of. So because of those factors, their influence to follow in their footsteps was very, very strong. Even though it felt predetermined to become a nurse, I gradually grew to love it even more after learning the kind of positive impact and flexibility that the job offers. Nursing to me, I would define it as a commitment to being a source of empathy and advocacy for our patients. I think it's also my personal opinion that, adjacently, the kindness that we treat our patients with, we should also treat people in our daily lives. This would be family, friends, strangers. By showing this kind of kindness to people outside of work, we can be a good representation for nurses nationwide. My personal nursing philosophy encircles patient advocacy, where I believe that a nurse should actively support the patient's feelings, needs, and rights, especially when open verbal communication is not available. There are these cases where the patient may be vulnerable, cannot speak up for themselves, and sometimes they can just feel unsafe or nervous, especially because healthcare is a very daunting field to be present in. This is so personal to me because I've struggled in the past, even now sometimes, for being an advocate for myself. So I want to become that voice for others when they feel unheard, which is a very painful experience, and I would hate for their well-being to be neglected. I think it's also important to address that advocacy can be seen through a legislative lens as well. Nurses can use their power and special experiences to advocate for bills. They can promote appropriate healthcare policies, procedure mandates, research funding, and more. Overall, communication can just be limited, and for that, as nurses should be very attentive to body language and signals that patients' needs are not being met. The theorist that I found most connection with in my personal nursing philosophy was Madeline Leininger, who created the transcultural nursing theory. The overall goal of this theory was to provide care congruent to the patient's culture instead of just working against it. This theory paved the way for diverse practices which hadn't been in much consideration before then. According to Leininger, culture is the learned, shared, and transmitted knowledge of values, beliefs, norms, and lifeways of a particular group that are generally transmitted intergenerationally and influence thinking, decisions, and actions in a patterned or certain ways. I wanted to stress the history aspect of that lengthy definition because history is what roots the importance of culture. It is their background that cannot be neglected. Through the lens of this theory, patients should be seen and assessed with more of a holistic overview of their background, customs, and lifestyle instead of just their medical history and symptoms. Madeline Leininger's transcultural nursing theory can be applied in many different ways, specifically in making accommodations and taking the extra step for patients' care. A situation where this theory can be applied would be when treating a female Muslim patient's care who can be personalized. In Islamic culture, it's seen as impermissible for an unrelated man and a woman to make contact or interact without a third party being present. There are exceptions that can be made for professional settings. However, if the patient feels more comfortable being treated by another person, their needs should be prioritized. They can easily be accommodated by directing a female doctor to examine the patient instead, which will create a more positive patient experience. I wanted to go over Ethical Provision 3 specifically because its emphasis of the nurse's duty and obligation to promote advocacy for the health and rights of the patient. This ties very directly into my nursing philosophy of providing patient needs even if they go unspoken and being an advocate for them and others. I've mentioned before that limited communication is an extra reason to be an advocate. You may be working with a patient who doesn't speak the same language as you. That language barrier is extra reason to be attentive to body language, signs, and ensure clear instructions through visual representation, and especially, of course, seeking out a translator before giving important information discussing their plan. A big short-term goal that I'm sure we all have is graduating, which was the number one thing on my mind. I don't just want to pass my classes, however, I want to excel and understand the material thoroughly so that I can apply what I've learned through the lessons into clinical practice. Another short-term goal that I was thinking of course, was passing the NCLEX. I used to think that this was an end goal to nursing, but I've long matured out of that idea, and I now understand it as just a step to the endless journey of nursing. Skill-wise, I want to work on communication, particularly expressing appropriate body language and tone when in conversation with patients and other professionals. It really is the smallest things that make or break interactions between people, and I want to clearly communicate compassion and understanding, especially for patients. A particular long-term goal was pursuing and understanding what I want as a nursing specialty, and hopefully being able to explore multiple, because I want to take advantage of the kind of flexibility and knowledge that nursing had to offer. My overall mission of being a nurse is to stay committed to ensuring that patients' needs, rights, and wants are being fully respected at all times. Looking into the future, I want to see myself as the nurse that patients feel themselves comfortable expressing themselves to, needs and otherwise. I want to be a warm presence and resource for empathy, and also the good experience that boosts their trust in other medical professionals for their future. Thank you for watching.